sometimes I can hear a lot of patients saying that every time I look at the mirror, I can see a big scar in front of my chest. It really make me think back what I have gone through, the painful journey, all these things really reflect to me. I need to help them to reduce the scar so that the trauma, the psychological impact is less.
Yeah. Specialist Centre isn't your typical hospital. It's Malaysia's premier quaternary hospital where rare, complex and next-level care comes to life. This is Quaternary Care, where our team of trusted super consultants are here to take on your toughest health battles using advanced technology and research-backed treatments all under one roof. Now, back to Nadia Azmi for UMSC's QRATED podcast.
Hi everyone, welcome back to QRATED. I'm Nadia Azmi and this is a podcast brought to you by Specialist Centre or UMSC, and this time we're talking about breast cancer. Earlier we've gone through the journey of diagnosis, surgery and also recovery. Now for part 2, let's take a closer look at what sets UMSC apart as a Quaternary Care Centre. Have you heard of that word before? Quaternary. And why that matters for patients who are facing complex conditions like breast cancer. So we are still with Prof. Adlinda and Prof. C. Can I go to maybe Prof. C first? Yeah. I mentioned UMSC being a Quaternary Care Centre. What does that mean?
Basically, what we see is actually quaternary, we really have to move up more than tertiary. Yeah. So we need a more subspecialized type of treatment, and then higher technology, higher different types of treatment, and improve the patient's outcome better, So very, very niche and very, very subspecialized. Yeah.
It also means that you have a team, or the hospital has a team of doctors, multidisciplinary doctors from different fields, from different areas, who work together for the patient's needs. So, Prof. Adlinda, what does this mean in practical terms for a breast cancer patient?
Actually, in addition to that, like for oncologists, we also focus on sort of just a a limited side. So for me, I do breast, lung, genitourinary and brain. So I just focus on that rather than all different cancers. So that's a bit different from, I think, other hospital. And the other thing about quaternary is we have available sort of clinical trials and research that would be an option in terms of treatment for the patient, which usually can be beneficial. So that's another extra thing about quaternary. And technology, like in terms of radiotherapy, we have a stereotactic radiosurgery or body radiotherapy that may not be available in all other hospitals. Yeah.
Right. We know in general that cancer care is evolving, including breast cancer care. So how is UMSC positioning itself at the forefront of innovation? We mentioned about that through clinical trials and research, from genomic profiling to testing new treatment combinations. What does this mean for the future of personalized care in Malaysia? Maybe Prof. C?
Yeah. So when we talk about breast cancer treatment, we really have moved on to genomic, all that, So meaning gene level, is really apart from we do normal type of treatment, but we want them more precise,
Yes.
So precision medicine is very, very important nowadays, because we don't want over-treat, but we also don't want under-treat. Okay, so it's like last time what we say, this stage 2, we go for stage 2 treatment, you need everything, and stage 1, you don't need most of the thing. But nowadays is we go up to subtypes. You check the subtypes and then only treat according to subtypes. And furthermore, when we go up to like what we do, we have after surgery, we even can test on the tumor and see what is the best treatment for this patient. Are we really need to give chemotherapy? Like what Prof. Adlinda said, we have reached the genomic type. And as well as the trial, a lot of clinical trial that our oncology team doing, that is very, really important, as well as make sure the treatment is up to the very high standard as well as give the best for our patient.
Okay. If let's say back in the day, we talk about chemotherapy, someone would visualize a very long, lengthy, painful process. Would you say that with, maybe AI now, new technologies, the chemotherapy, for example, if I were to take that as an example, it's more friendly or more gentle to the patient?
Okay, I wouldn't say in terms of chemotherapy we use AI per se.
Okay.
But we use there is a sort of database sort of analysis from UK. We call it Predict.
Okay.
So for each patient, we will key in all relevant sort of factors in terms of the cancer, and we can predict what benefit they get from sort of different treatment.
Okay.
So it kind of useful for the patient to see what benefit for each treatment, like the chemotherapy, the hormone therapy, the targeted therapy. And ultimately, we will have discussion and patient will sort of make the final decision whether they agree for one treatment or the other. But even with that, we have to see the patient itself. Are these treatments suitable for them? Are they fit enough for the treatment? That's another thing. And we also have like escalation and de-escalation of treatment. Like Prof C mentioned earlier, if patient has hormone positive and their nodes are negative, some of them actually don't need chemotherapy.
Okay.
So we have a genomic testing to see at the gene level, what is the risk of recurrence. So that might be helpful. Not all the time, because sometimes we still need to use our sort of, there are still like a group of patients we don't really know what benefit do they get from chemotherapy. So that needs discussion, the pro and the cons, especially the young patient. So in terms of the treatment earlier, you mentioned about clinical trial. I already mentioned chemotherapy, hormone, etc. What I did not or have not mentioned is the immunotherapy.
Okay.
And also there's a new drug, a new kit on the block, the antibody-drug conjugate. So these are coming into the scene for the late stage and also very early stage. So we have clinical trials going on and patient has the opportunity to get involved in the clinical trial. We facilitate that when they come to UMSC.
At the same time, it gives new hope to these patients. There's a lot more available options out there for them to use for their benefit for the long run. Now, I think in surgery, we have robotic assisted surgery. Of course, we have targeted therapy. So how are these new technologies transforming the treatment journey of a patient at UMSC in terms of precision, recovery, and also the side effect management?
Yeah. So when we talk about technology, from 2016, we have started our intraoperative radiotherapy, which is like surgery together with radiotherapy during the surgery.
Okay.
And this type of technique already like started quite some time in UK, and the result is very good. But of course, we don't say it's suitable for all the patient. It's suitable for early breast cancer with certain subtypes. You know, from there we can see a lot of changes and a lot of difference in patients' outcome, and we are trying to achieve a safety oncology as well as we don't jeopardize their quality of life. We want to improve their aesthetic and cosmetic outcome so that it reflects patients after treatments quality of life. So all these have moved on slowly and let us know that we can do more actually, because we want to help them to reduce their what they call the trauma of going through the surgery, because scar is one of the trauma to them. Because sometimes I can hear a lot of patients saying that every time I look at the mirror, I can see a big scar in front of my chest. It really make me think back what I have gone through, the painful journey, you know. All these things really reflect to me. I need to help them to reduce the scar so that the trauma, the psychological impact is less.
Yeah.
No, we don't say there's no psychological impact at all. But of course, we want them to live like a normal people after all the treatment, you know. So that's come our minimally invasive surgery, that we reduce the scar, try to hide the scar for patient. Breast reconstruction, try to rebuild the breast after the mastectomy or removal of the whole breast, so that their body imbalancing, all that can reduce. And also we talk about robotic assisted nowadays, because precision help us to reduce the complication, allow us to cut as much we need and not over cutting, all that, So all the precision help us to reduce a lot and improve the outcome as well, reduce the nipple necrosis, reduce a lot of complication from the surgery. And sometimes even one of my colleague, they even discharge patients same day after surgery using the robotic assisted, So all these have like really slowly moved on to reduce the trauma, reduce the psychological impact. Yeah.
Now, both of you are lecturers. You teach medical students, but apart from that, of course, you go into the clinic and you see patients almost on a daily basis. I'm thinking, can you share with us some of inspirational stories that you've seen from your patients that I think, it's worth telling that story right here through this QRATED podcast?
You first.
Because I'm sure you've seen
a lot
them
of
go
story.
through
Yeah.
such a big thing in their lives.
Okay, just now we talk about the sort of go for screening. The earlier we diagnose, the higher chance of curing them from the cancer. But sometimes patient can have recurrence. So I remember one patient, she had stage 4, like after the initial surgery, I think 1 year after, she had spread to the liver and subsequently to the chest wall, also to the brain. That was many years ago. She is still alive.
How old is she?
She is in her 50s or early 60s.
Okay.
So she has been having treatment and dealing with the cancer, I think easily 10 years or more. She's still alive. So just to say that even if they are diagnosed at stage 4 or if the cancer has come back, because nowadays there's a lot of development. We try to improve the outcome of the breast cancer patient. And even if they have stage 4, we are trying to turn it into a sort of chronic disease, meaning that we have treatment to control the cancer.
Right.
And with that, it's very important to balance the quality of life.
Yeah.
So we adjust the treatment so that it's something that they can take. At the same time, maintain their normal, activities.
Yes.
So that is the aim. So with the new treatment, we want to improve survival, and at the same time, we want to manage it so that we minimize the side effects. For example, like the surgery, they try to make it better. And with other treatment, we want to improve the survival.
Yeah.
And also try to reduce the side effects so they can live with it.
I had an aunt, she has already passed on, but she lived with cancer for more than 20 years, I would say. And what I saw from her, what I observed was that her will to live, semangat tu, very, very kuat.
Yeah.
Her will to power through, to survive is there. And she made sure that she kept her hobbies. She didn't lose her normal, daily routine. She lived a normal life, did what she loved and did it with passion. So how do you see from your patients, how does that mental or emotional part of their mindset or the mentality affect how they can troop through such a arduous journey?
I think breast cancer is not only cancer alone, not only surgery or chemotherapy treatment alone, a lot of psychological factors was put into this disease, because first thing is when they heard about the word of C is like C equals to death last time. Last time people think of that like really, they still holding the same belief, sometimes. A lot of time that makes them not coming early for diagnosis when even they feel something, it's not a lump yet. It's a small hardness, all these bring a lot of issue here. That's why social media very important, helping us to let them know breast cancer is not a death sentence, So first thing, very, very crucial about that. Second thing, how can we maintain their quality of life, reduce their psychological distress during the treatment itself, not only surgery, but all the adjuvant, or we call following or before that, before surgery, we also have neoadjuvant chemo. How can we support them? The support system is very important. The support system can be from the family themselves, family members, and also our survivor group. That really help them. Oh, you are the same with me, because you look at me, I already gone through the treatment. It's okay, even though you have some discomfort during the chemotherapy or surgery, then you can go through it. You can pull through it because everybody is supporting and encourage them. All this very important. And as well as the doctors itself. So sometimes we have to make friends with our patient, like Prof. Adlinda, you asked, sometimes we have to really, even after the treatment consultation period, they come and look for us, and sometimes we even have chat with coffee or that, you see. So we need to slowly what we call slowly go into their life and adjust according to their life and our treatment. So very, very crucial. Sometimes I don't even force them like, you must come today or what. No, you cannot. We have to slowly adjust according, like Prof. Adlinda. Okay, you come that day because it's suitable. You come to hospital for something or that, you know. Sometimes it's like that.
I think that's what the color pink is all about. We uplift each other. We understand each other, hold each other's hands.
They need a support system, basically, I think.
Yeah. Can we talk a little bit about the breast reconstruction, Prof. C? When it comes to breast reconstruction, what are the main options that are available for patients? When is probably the right time to consider reconstruction? And how do you work with Prof. Adlinda to make sure that you get to decide what suits the best for each patient based on the medical, emotional, and also surgical readiness?
What we talk about is a lot of issue around when we decide for breast reconstruction. Yeah. So let's talk about like patient that non-pregnant patient and pregnant patient, you see. So we do have a lot of patient that got their cancer during pregnancy, you know. So that one is even intense, emotional, different, you know.
I can imagine,
So all this, we always have to tie in a lot of factors. So let's say we talk about young breast cancer patient, they really cannot accept when the bad news is it's a breast cancer, they have to lose their breast, right? So all these things really will stop them from coming for further treatment, one thing. And they don't even want to look at a doctor that going to have treatment, do surgery for them.
Will you actually get patients who just stop midway?
Yeah, we do have.
Okay.
Even though nowadays we do offer all the young breast cancer patient for reconstruction, even though we can't do immediate, sometimes they need radiotherapy first, they need chemotherapy first, then only we offer them delayed.
Yeah.
But they just we don't say losing breast is first thing that causing them to come over. Sometimes it's their own role as a mother, as a lot of role in the society. They just can't come for treatment. They tell me, I say, ayo, what can we do? You know, all this, a lot of, it's not only one issue that cause them delay treatment, refuse treatment, you know. So all this is like, they really need some support system around, you know. So, feel sad, but we really support them. So anytime, please, once they call us, please come over. We try to help. Then sometimes I do send them to Prof. Adlinda to start other treatment first, so that can control the disease before we go for surgery, you know.
This is always the challenge when women wear multiple hats.
Yeah.
We have multiple roles. We are doing so many things. And even to the point where when they need treatment for cancer, they opt to choose others above themselves. So,
like pregnant lady, you know, they want to save their baby, you know, they're very scared that our treatment can cause problem to the baby. Yeah, I think myself and Prof. Adlinda, we are working in a group that we always have referral from different channel that patients pregnant and then have breast cancer. What are we going to do? We always sit down and discuss, discuss what is the best. And even we involve more people around. We need a social welfare team. We need gynecological team, all these things is very, very crucial because at the end of the day, we want to save the mom and the baby. Yeah.
Of course. And I think perhaps it's not just important that there is engagement between the patient and the doctors, but also the patient and other patients where they can share their experiences. They're going through the same thing, feeling the same emotions, for them to talk to each other. Perhaps that is a very supportive ecosystem that a patient will need. Now, to the both of you, how do you see in your day-to-day work multidisciplinary collaboration, evidence-based protocols and technologies like AI or robotic surgery? How do they come together to give patients the best possible care at UMSC? Prof. Adlinda, maybe first.
I think we always practice evidence-based medicine in UMSC. So it is not just from our own sort of thinking or idea. We always refer to the international sort of guidelines. Is always in line. So that's evidence-based. In terms of the technology, I think we have different technologies in terms of surgery and radiotherapy. We would, recommend as appropriate to the patient these different technologies. As I mentioned to you earlier, we have clinical trials. If it's relevant to the patient, we will facilitate this. Working as a multidisciplinary team is very important. So, for example, if patient, Prof. C refer patient to me for neoadjuvant, like treatment before surgery, I will make sure that patient will see her back midway and at the end, so that we can coordinate the timing of different treatment. So it kind of flow very nicely. And we make sure that patient also understand. So they know, okay, I have to see Prof. C like after 3 cycles of chemo, etc. So I think we work quite well in a team.
Prof. C, before we wrap up as well, your view.
So multidiscipline has been the point of care nowadays in cancer treatment. Not only breast cancer and a lot of cancer, we really need input from everybody. And we want to move forward for, as well as the input is very evidence-based and international recommendation. So all these have drive us as well as help us to offer the best care for our patient. So we need each other actually. It's a needs. It's not a sort of like adjunct, no more adjunct. It's like everybody need each other to help a patient, So every patient, we know roughly who needs to be in as an active partner and also passive partner as well. So everybody know our role, you see. Sometimes and also the phases of treatment. Sometimes I'm the active partner during the phases of surgery, but my colleague like Prof. Adlinda Oncology as well as radiologist is like our passive partner, helping together and make sure we don't outline and over something that remind us what we need to go later on, or that, very, very important. If not, then we cannot like technique of surgery, technique of reconstruction. We also need to know whether patient go for radiotherapy or not. All this we always talk together. All this very crucial to make sure the treatment is not over, not under, but always evidence-based, always best care for our patient.
Okay, now very briefly, before we conclude this podcast, perhaps something that Prof. Adlinda and Prof. C want to say to our viewers or listeners, not just to women, but also to men, very briefly, your last words of advice or words of wisdom.
I think we talk a lot.
That's why.
It could be as simple as, go and take that first step for a screening if you have not done so, or, if they have to care for a mother or an aunt who is a breast cancer patient, how can they go through this together?
I think first thing, no fear to cancer. That is very important. No fear to cancer, and you always have somebody with you. Hope is always around the corner.
Thank you, Prof. C and Prof. Adlinda.
I think it's very important to come forward if they have any symptoms. It's a good sort of practice, like for women over 40, to have a screening mammogram so that we can detect the cancer early. But for every stage of the treatment, every stage of the cancer, there are available treatment, and there's a lot of development and improvement. So, we can sort of individualize the treatment for the patient to ensure that we improve the outcome and the survival, at the same time maintain their quality of life.
All right. Thank you so much to Prof. Adlinda and Prof. C for joining us on QRATED, talking about breast cancer and breast cancer care. Indeed, UMSC is a leader in transformative cancer care, delivering not just treatment, but renewed life through cutting-edge methods and also collaborative medical excellence. So for all patients out there, don't fear cancer, as Prof. C mentioned, and you take that first step if you need to. Take a screening, take a mammogram, and detect, prevent what we don't want to happen in our lives. All right, let's heal together. Let's survive together, because together we can do this if we hold hands and support one another. So don't forget to QRate us by sharing, commenting, subscribing, and following us on QRated. Until the next time, please do take care and never ever fear that C word, cancer. We can go through this together. See you guys next time.
Did you enjoy today's curated episode? Well, don't forget to tune in for the next episode of Curated Podcast by UMSC. To learn more about our consultants, specialties, or to book an appointment, visit umsc.my. For health tips, behind-the-scenes content, and expert insights, follow UMSC on Instagram, Facebook, TikTok, Spotify, and Apple Podcasts. Till next time!